lovely tour on. So Tor, can you tell me a bit about yourself and what life looked like before your cancer diagnosis?
Oh, so a bit about me. So I'm now 32 and I've basically just been a travel girl my whole life. So I moved to China when I was 18 and I've just been busy living in different countries. So yeah, mainly in China, but I also worked in the Arctic, Taiwan, Inner Mongolia. I went everywhere and did everything up until cancer diagnosis.
You did a lot.
I did, yeah.
You
I
did.
avoided England.
I don't blame you. Right. Now someone's trying to call me, honestly. Okay, so what type of cancer were you diagnosed with and what stage were you at?
You mean when I was diagnosed?
Yeah, so what
Um,
type of cancer were you diagnosed with?
so I was diagnosed with a rare form of appendix cancer. Well, appendix cancer is rare, which is called LAMN or LAM, which stands for, I can't even say it, low grade appendix mucosium. I don't even know. But yeah,
Wow.
LAMN.
Okay. And then did they give you a stage when they diagnosed you?
No, because I had my surgery, emergency surgery in Taiwan, and they told me it was benign because they didn't want to worry me. So it became a whole confusing story, and yeah, I didn't. No one really spoke to me about it.
So how did you then find out that you had cancer?
Initially, I flew back to the UK and I went to a doctor's appointment to have a checkup on my wound. And the doctor was like, "Oh yeah, yeah, so yeah, it was cancerous." And I was like, "What?" And then that's the first time that I found out about it. And then I received a letter in the post for a cancer follow up. And then that's when it started to hit me that it was actually cancer.
I mean, that is just ridiculous and insane.
Yeah.
So describe the moment then that how was you feeling when you then were actually told that it was actually cancer?
I think initially it didn't really sink in, and it more started to sink in maybe even like 6 months after when I started to have the hospital appointments and the follow ups and CT scans and MRI scans. I think that's when it started to hit me. And initially, I was just kind of just trying to get back on my feet and just get back to normal. So
Mm,
I think it hit me for quite a while that it actually was cancer. And then I think even a year later was when it finally like sunk in.
yeah. That's the thing. It's such a surreal thing, isn't it?
Yeah, and I think because it was, I just didn't have time to process it all, and then, and then because Taiwan told me it was benign, um, I almost then didn't know what to believe when people were telling me it was
Mm,
cancer. So yeah,
yeah, no, definitely. So how did you t cope with then sort of telling your family and your friends?
um, I don't even know how I told them. I think I just started to go to the hospital checkups, and then it just became common knowledge that I was going to the hospital. But
Mm,
like, I'm a doctor, and I never spoke to my brothers about it. I just let other family members tell other family members. So I just didn't really speak to anyone. I just went to the scans and plodded along, really. So I never had
mm.
that like conversation. Only I'd say more recently I started to have the conversation with family members.
And how did those conversations go? Like how were they sort of like feeling about it all?
I think I don't know. I kind of think it took a while for everyone to acknowledge that it was cancerous. I think
Mm,
because I did surgery and everything abroad, it was just so complicated. And then I only started to have conversations probably recently because I had a cancer scare, and then that's when I started to talk to my family about it and say like, "Oh, this is what I'm scared of, and what if it comes back?" And that's when the conversations opened up a little bit more.
yeah. Yeah, I guess because you weren't in the same country, they weren't visible to what your day to day was looking like.
Yeah, like I'm quite glad that no one could see me in the hospital in Taiwan because it was quite hard. And I think my mum wouldn't have been able to like cope with it, to be honest. I don't think she would have liked seeing me like in the state that I was in. And then yeah, and then I basically like flew home in a wheelchair. And then from there I just tried to like get back on my feet. So yeah, it's a bit of a weird one.
Yeah, definitely. I mean, so what treatment did you have for the cancer?
So I had emergency surgery in Taiwan. So I had my appendix removed, some lymph nodes removed, and half of my bowel removed. And then, but I didn't know this. I didn't know this until I read my discharge paperwork. So yeah, and then I originally thought that they'd just removed a benign tumor. And then obviously the stress started when I got home because like theoretically if you've got appendix cancer you should go see a specialist because yeah, because then they know exactly what to do, exactly what to look for. And I think it adds more fear that I wasn't operated on by a specialist, because now I'm worried like if any tiny little cell was left behind, then I'm at risk of it coming back. And then if it comes back, you basically have a huge surgery called the mother of all surgeries, where like 8 to 10 organs are removed. So like yeah, that's my risk. If any tiny little cell remained, then I'm at risk of it coming back, which is the fear, I guess.
Mm. Yeah, I mean, that's totally understandable. It, it must be really hard to not have that constantly in your mind.
Yeah, I mean, for me, I've only just started to relax a little bit because for the first 2 years, I just did CTs, MRIs, and then every time I did a CT scan, they said my ovaries were swollen. And at one point, they said it could be a tumor. So then I had the fear that it had come back. And it's just been, then I did an MRI, and then I did another CT, and then another MRI. And it felt like it was like never ending, just waiting to find out if it's come back or not. Um, but yeah, and then now I go for scans every 6 months to check if it's come back or not.
So did you contact the hospital that actually then performed the surgery on you? Like, like why they didn't tell you and why it wasn't a
I didn't.
specialist?
Well, I think specialists are so rare, so I don't even know if there's a specialist in Taiwan. And because I was in so much pain and it was emergency surgery, I guess they did what they had to do. And to be honest,
Mm,
I do think the people in Taiwan did a really good job. Like, I was very lucky that they didn't cut into my appendix, because if they cut in, the cancer would have spread all through my abdomen, which I do
okay.
know happened to another lady in Taiwan. About a year later after me, she had the exact same problem, but they cut into her appendix.
Oh God.
So I was really lucky that they didn't cut into my appendix and they just removed it. So then it kind of, all the cancer was encapsulated in the appendix. Um, but yeah, I did contact them afterwards, being like, I'm really confused because now I'm back in the UK. I'm being told that this is cancer. And they were like, yeah, but we've taken care of it, as in they've taken it out. And I was like, yeah, but I need to know, like, is it benign or is it cancer? And they were like, oh, we just didn't want to worry you. You're fine. But I think it's just because there's not a lot of knowledge about appendix cancer. And even
No.
that, he contacted me a year later to ask some questions himself when the other woman went in with appendix cancer. So I think people are still learning about it.
Wow. I mean, yeah, it was only until I started speaking to you that I didn't even know about appendix cancer, but I saw something the other day and it was saying how appendix cancer in the young particularly is on the rise.
Yeah. Yeah, you'd think that something so small and like insignificant. But I guess cancer's just cells, and your whole body's made of cells, so you can just get cancer anywhere.
Yeah, absolutely. So, what fears did you have in terms of the side effects from the treatment?
So initially, like I said, it was just like trying to walk again, and my stomach looked like it was open. So one of
Mm,
my fears was that my stomach was going to burst open, especially on the aeroplane, because it looked
mm,
like they hadn't stitched me up properly. And so I remember ringing my mum and crying and being like, I'm so scared that it's going to like burst open through the pressure on the plane. And at the time, she was like, "No, I'm sure it's fine. Don't worry." And then when I landed and showed her my stomach, she was like, "Oh, I see what you mean now." And she understood because it looked like there was a hole in my stomach where they hadn't stitched the top layer. So that was like
Mhm.
my initial. And then obviously now my main fear is if it's going to come back, like how it's going to affect me in the future, having a family, meeting someone,
Mm.
dating. Like I think it's a lot to put someone else through when it's all right if you've been with them for like 5 years, they're kind of like locked in and they have to support you with it. But it's really hard to find a new partner and be like, but every 6 months I'm going to be stressed.
Yeah, but if they are the right person, I think it's
Yeah.
definitely something that you shouldn't that shouldn't be in your thoughts. Like if it's
Yeah.
that would be on them, that wouldn't be on you.
Yeah. I have had people say to me that are like, to be honest, I think it's a lot to take on so soon. And so I've been like, okay,
That's
no.
awful. Oh my God. No,
Yeah.
that's no, yeah. So what support did you have going through and after the treatment, like professional support?
Professional support, I don't think I really had any because I had everything done in Taiwan. When I got back to the UK though, I was just kind of like, okay, you've had the operation now, like, and I wasn't offered anything.
Mm.
And so I referred myself actually to an appendix cancer specialist in the UK, um, so that I could transfer hospitals. But yeah, then I wasn't really offered anything. And then I rang Macmillan myself to refer myself to counselling because I was struggling quite a lot with the whole ordeal. Like I was told that I had a bit of PTSD from the hospital in Taiwan.
Mm.
Um, but I found it quite difficult. So yeah, I didn't really get much help to be honest when I was home.
I mean, the fact that you had to call Macmillan yourself,
Yeah.
that,
Yeah, it was because I burst out crying one day at work, and then so I eventually told someone what had happened, and they said, "Why don't you call Macmillan?" And I didn't even know that like they offered counselling. So then I decided to refer myself. Yeah.
I mean, yeah. But it makes you wonder as well then, like what aftercare they must not have aftercare in Taiwan if they didn't sort of forward anything onto you.
Taiwan was more or less like, "Yep, you can do what you want now. Off you go." Like
Mhm.
you're go. Taiwan
Wow,
was very like out of the hospital and you're free again. Yeah.
that is insane. What would you say that cancer has then impacted the most for you?
Oof. I don't know to be honest. I just think I'm not the same as I was before. Like I still think I'm trying to get over it and trying to figure things out.
Mm.
I think it's impacted my life quite a lot really because yeah, I just feel like I'm not the same as I was before. I used to be like carefree, do anything, like swinging off mountains and skydiving and doing all of this stuff. And now I just kind of like now I'm scared of lightning because I think,
Mm.
oh, if it was a million chance to get appendix cancer, like the chances of getting struck by lightning are like more than that. So I think it's like changed my, I guess that's very negative, but it has changed my like view on things.
But that's the
Yeah.
thing, though. It isn't, I get, I have people on here who, we talk positively and we talk about how, our lives are better now, but that's not the case for everyone. And that needs to be, people need to realize that it's not always going to be sunshine and rainbows.
Yeah, like honestly, I just think it's so hard to come to terms with, especially like it was a week before my 30th birthday, and this might sound really petty, but I hate it when I see people post on Instagram their 30th birthday with like balloons, like yay, like in a dress and balloons and celebrating, because I'm like, I like was barely alive,
Yeah,
and
you
it
didn't
is,
need
I don't know,
that.
yeah. So it's hard to like compare yourself to other people in the same age bracket.
And did you find then you didn't have, how was your support then like from your friends when you were going through it, who were then, the same kind of age as you?
I've got some amazing friends, but most of my closest friends are who I've met whilst traveling. So they weren't necessarily in the same place as me at the same time. And then
Mm.
because I left when I was 18, going back to live at my mum and dad's house, I didn't really feel like I had a lot of friends for support. Um, I did have some friends that I went to school with. They got back in touch with me, and they were brilliant. Like they were really supportive. But yeah, I think it was difficult as well because it wasn't my life in England.
Mm.
I don't know if that makes sense. And actually, like my grandma was like really supportive. Um, yeah, so I spent a lot of time with my grandma.
That's nice.
Yeah.
And so what does life look like for you now?
So now I'm back in China. I feel like I had to come back to see how I feel being back here, and I still haven't figured out how I feel being back. And then I still obviously have to go and do scans and tests, but I'm feeling a lot better. Like literally the past couple of days, I felt the best that I felt, and it's taken 2 years to stop feeling so like tired all the time.
Mm.
Um, and like I still get like bowel pain and stuff from obviously having half my bowel removed, but yeah, so I'm just still figuring life out, to be honest. Back in China, I might go do some scans here next time instead of flying back to England,
Mm.
because one thing that I found really difficult in England was the waiting times.
Yeah. Is
So
it quicker in China then?
it's so quick, like I can do the scan and then get the results within 3 days. And then for
Mm.
me, that like stops me panicking because I like as soon as I do the scan, I'm then on like self-destruct mode until I get the results. And in the UK, because every single time I've done a scan, they've said my ovaries are swollen. I've then had the fear until they then say, "Oh, actually, they're okay." So I found like the waiting around quite difficult because last time I did a CT scan, they said, "Oh, your ovaries are swollen, so we're going to have to do an MRI." But then I had to wait weeks for the MRI, and then you do the MRI, and then you wait again for the results. And like I even asked like, okay, so what could it be? And they were like, well, obviously we're hoping it's nothing, but it could also have come back. And so you're literally waiting to find out, do I have cancer or don't I? And you're just left.
And it's that anxiety, it just eats you up, doesn't it?
Yeah, like I kept thinking, okay, so if it's come back, like what am I gonna do? Like what
Mm.
am I gonna do about children if it's in my ovaries? Am I gonna have a hysterectomy? And you start like thinking all of this stuff, trying to process it. And I quite like to know like all the details. Like I'm quite, I don't know, like I like to know everything.
Yeah.
So I them like go into detail about all the scientific whatever's going on than just give me a very brief answer.
Yeah.
Uh,
But that's understandable. It's your body. You want to know what's what and what you need to plan for or put in place.
Yeah, but I think now, and I think a lot of people in the appendix cancer community probably agree, but like now I'm never convinced that they've found it because like my tumor was growing for 6 years and I kept going to doctors and kept complaining of pain. And I even found my old doctor's note that said, client has been complaining of pain for 2 years and no one ever like helped. And so now I've got this fear because it's so rare that it's
Mm.
all just going to get disregarded again. So I feel like I'm constantly like being my own advocate all the time.
Unfortunately, I think sometimes you have to be
Yeah.
because
Yeah.
they just, whether it's because they just get so many people who, I think you get on one hand, you get the people who actually are in pain and do need help. And then on the other hand, you get the ones who just, they have something wrong, but everyone just assumes it's cancer because they've gone onto Google and they're assuming it's cancer. And I
Yeah.
think in a room of a crowded lot, you've just got to shout louder.
Yeah. Because that's the only way that I found out that I had it because I
Mm.
was in so much pain in Taiwan, and then I just thought, okay, I've had this pain before, I'll just get in bed. So like I got in bed and then the pain just continued, and it was like every time I ate something I was in excruciating pain. So I hadn't eaten in like a week. And I eventually went to see a doctor, and he was like brilliant. He was very helpful, but he just like prescribed me some pain relief and sent me home. And then I went back to him, and luckily he must have seen something in me, because then he
Mm.
agreed to help. So then he sent me to like a gastroenterologist, and they did a CT scan of my stomach, and they said it was clear, and they sent me home. So then he sent me to a gynecologist. They did an ultrasound. Sorry, the gastro guy did an ultrasound. Then I went to a gynecologist. They also did an ultrasound, said it was clear, sent me home. And so I was like just going around to loads of different doctors, and everyone was just telling me that nothing was wrong. And like I just remember like sitting on the floor like in pain and crying and being like, I just wish someone would listen.
Mm.
And so I got a taxi to go home, and as the taxi pulled up at my house, something literally screamed inside me, like, go to the hospital, like, go to the hospital. And so I told the taxi driver to take me to the nearest hospital. And when I got there, they did bloods, they did an ultrasound, and again, they were like, your bloods are fine, you're healthy, there's nothing wrong. And I just said, please give me a CT scan, like, please. Like, and they were like, you don't need a CT scan, like, everything's come back clear. And I was like, just please give me a CT scan. And so they eventually agreed to give me a CT scan, probably because I was paying for it as well. And
Mm.
then, yeah, then eventually they came back and said, like, oh, like, there's a mass, like, in your stomach. So, yeah, then it all started. But and then I asked them, like, oh, can I fly home? And they said, you're not going to survive the flight. So then I had no choice but to go into surgery.
Oh God. See, that's absolutely mental.
Yeah, it was quite a lot to like process, like them saying like, oh, you're probably not gonna survive if we now. So I just had to like ring my mum and dad and be like, look, I'm in hospital in Taiwan, going into surgery now. We don't know what it is. And then, yeah.
I mean, thank God that you did keep going back and you did then go to the hospital and, you know, urge them to actually do it.
Yeah, I was in so much pain. I just knew something was wrong, and I just was like,
Yeah.
just someone please, like, find out what's causing this pain. And I think what had happened is the tumor had pushed into my bowel, and my bowel had like died. So
Okay.
that's what was causing the pain, I think.
I mean,
Yeah.
yeah, fair play to you for just pushing and pushing and pushing. I think sometimes a lot of people will just, if they're told once that everything's okay and it's all clear and stuff, then they just believe it because, you know, doctors and hospitals know what they're talking about, right?
Yeah, exactly. I don't know, something inside me was screaming like you need to get help. And I'm so glad that I did. And
I'm so glad you did.
I don't know if you believe in superstition, but I went to a Taiwanese festival where if you get hit by a firework, it brings you good luck for the year. So maybe that firework was good luck.
Maybe.
Maybe.
Maybe. Well, thank God that you did. So, if anyone is listening who is in the thick of their cancer battle right now, what would you say to them?
I actually don't know, you know.
Mhm.
I'd say it does get better and it gets easier. Yeah. And actually, the cancer community has probably been like the most supportive for me. Like
Yeah.
speaking to other people in the community is so helpful, and probably more helpful, especially for me, than speaking to like friends or family or people that can't quite get it.
Mm. Yeah, there's definitely like that's what I found, and it doesn't matter what cancer you have. It's definitely, yeah. It's just this bond that we all have, and If whatever cancer you've had and whatever story you've gone through and whatever treatment you've had, we all just have something that resonates with the other person.
Yeah, like, I think once you've had a cancer diagnosis, you can understand like everyone else's fear
Yeah.
and the anxiety and having to go for tests. And I think once you get cancer, it's always going to be in your mind about if it's going to come back.
Yeah. Yeah, no, definitely. Well, thank you so much for coming on. We got there in the end.
That's it. I was trying not to cry, but I did quite well actually.
You did really well. Well done you. I'm proud of you. Well done. Um,
Well,
but what Tor has not mentioned, which I'm going to plug for her now, is
yeah,
she is a personalized trainer for cancer patients. So if you are going through, you can do people who are going through treatment, can't you?
yeah. So anyone that's preparing for treatment, like if they want to get fit for surgery to improve their recovery, or during treatment or after treatment,
Yes,
and
as I well know, because I'm doing it.
yeah, you're one of my victims.
I am.
um, but yeah, I basically decided to do it because I used to love running. I used to run a lot of half marathons, and then I just, because of the lack of support, I just couldn't get back into fitness. I just couldn't
Mm,
do it, and then I downloading plans off the internet, trying to like follow them, and I just every time I'd follow a plan, I was like dead. I'd just be in bed for a whole week. So, and also it kept my mind active whilst
mm.
I was waiting for these MRIs. So I decided to study training, and then I studied cancer training. But like actually, that would be a tip: study something, study something whilst waiting for your scans, because it kept me from going insane.
Yeah. Yeah, no, that's definitely a good tip. Because then, yeah, you're focused on something else and then time goes quicker.
Yeah, I was so focused on doing that. I just did it all day, every day. Because if I didn't do it, I'd then start panicking about the scan results.
Yeah. Yeah, no,
So,
definitely. So yeah, so if you are going through cancer or you're on the other side, but you're trying to get into, exercise and you can't find a personal trainer that can help you, I can vouch for Tor. She has changed me
yeah,
and I feel so much better. But thank you so much, Tor, for coming on. I really appreciate it.
that's okay. Thank you for having me on here,
You're
spreading
most
awareness.
welcome. So if anyone else would like to come on Unbreakable Voices, like I said, we're having a break after August for a month and we'll be starting season 2 in October. So if you would like to come on, then just message me. But thank you, Tor. I know it's like nighttime now in China, so I'll let you go to bed. And yeah, thank you for joining.
Thank you.
See you
Bye.
later. Bye.